My pickleball buddy just told me his friend got diagnosed with diabetes.
Oh,
And would you believe he thinks there is nothing he can do? He said diabetes and amputations run in his family, so he now needs to prepare for losing a foot or at least a toe.
that's crazy. There's absolutely no reason for that. We know this isn't how diabetes works. He can save himself a lot of pain and aggravation, no need for amputations or any of the other terrible complications. Diabetes sucks.
But at Simply Diabetes, we can help you manage your diabetes cheaper and easier.
We are not medical professionals. We are people with diabetes, just like you.
Welcome.
Diabetes is a nasty disease, and it can rob you of years of your life and of enjoyment if you let it. But that's the key. If you let it, you don't have to let it. With many diseases, you're at the mercy of the disease. If you have cancer or cerebral palsy or some other disease, the doctors can often help you, but you yourself aren't in control. With diabetes, it's different. In a way, we are lucky. We are in almost full control of what diabetes will do to us. Ignore it and it will be a misery. But follow a few sensible guidelines and you can delay or even completely avoid any horrible complications.
So, let's talk about the most common mistakes people make while managing their diabetes. If you avoid them, you'll go a long way towards good health.
We have made some of these mistakes too. So don't feel you need to be perfect all the time. Even if you don't do everything right, at least do something. No need for amputations, going deaf, blind, or ending up in a dialysis machine.
So, here are the most common mistakes. Not knowing your numbers. How can you manage your diabetes if you don't know where you're not where you are? There are two numbers that are important to know. The blood glucose gives you an exact picture of what your body is doing at the moment. It can help you decide what to eat and how much you need to move. The other number, A1C, tells you how well you've been doing over the last 3 months. This is an average measurement, and it helps you figure out whether you need to tweak your lifestyle overall. Without knowing the numbers, you are flying blind. How can you adjust if you don't even know how you're doing? You wouldn't drive without knowing how fast you're going and how much gas you have in the tank. You shouldn't drive your body without knowing the basics either.
If your health insurance covers it, or if you can afford it, I highly recommend continuous glucose monitoring, or CGM. It can tell you exactly at every moment what your glucose is doing. This allows you to adjust, avoiding the dangerous highs and lows. Eat when your sugar is low, move and drink water when it's high. If you don't have a CGM, you will need to use a glucometer. It will give you good info at the time of the measure. So follow your doctor's advice about how often to measure. If you don't have specifics from your doctor, measure at least first thing in the morning and about 2 hours after dinner. You might feel weird about pricking your own fingers, but it's a small price to pay for avoiding the disastrous consequences of uncontrolled diabetes. It's easy to forget to measure. If that's you, set up a reminder on your phone or get an app that will remember for you.
Eating a bad diet. We humans love good food. It's one of our pleasures. But good can mean different things to different people. High carb, high sugar, processed food might taste good to us, but it is in fact terrible for our bodies. It's not only bad for blood sugar, it's also bad for our weight and overall health. Eating food like that regularly is a disaster for diabetics.
So add veggies, preferably fresh. Eat good protein, fiber, and healthy fats. It is also good to avoid or at least cut down on processed food.
This diet can be expensive.
It can be. But with a little bit of planning, it doesn't have to be. We have a series of videos with specifics of how to eat. We don't spend a lot of money on food. In fact, we spend less than average. And we don't spend a lot of time in the kitchen either.
Check out our series of cheap and quick meals for diabetics. The link is below the video. Eating at wrong times. People skip meals all the time. Some people even think that if they don't eat breakfast, they will lose weight. It might be okay to skip a meal if your blood sugar is comfortably in range. But if your glucose is low and then you skip a meal, you can end up with a sugar low. These are not only unpleasant, they can be dangerous, and in extreme cases, even deadly.
Surprisingly, you can even get a sugar high if you're not eating. That's because your liver stores glucose and releases it when you get low. So measure your sugar and use it as a guide. Eat if you need to. You need your sugar to stay in the healthy range.
So if your sugar is high, you can skip a meal.
That depends on the person. You often skip lunches and it works for you. When I tried that, it was a disaster. I skipped a meal and 2 hours later, I would get so hungry that I'd eat everything in sight. And the things that appeal the most at that time are precisely the things we shouldn't be eating.
In other words, listen to your body.
Exactly.
Assuming that all carbs are the same. We used to think a calorie is a calorie and didn't matter what we ate. We now know it's not true. We should pay attention to carbs, but not all carbs have been created equal. Simple carbs, most of all sugar, white bread, pasta, rice, and the like, are the worst. Our bodies absorb these quickly, and the result is a sky-high glucose. People call it a spike, but it isn't always like that. Sometimes it goes up and stays there. That's bad.
Complex carbs take time to digest, and their effect isn't immediate. And some carbs have no effect at all because we don't digest them. We call these carbs fiber, and they are hugely helpful in our diabetes management. Not taking meds as prescribed. We are all about eating right and exercising, but if your diabetes progresses, you might need medication.
The best meds in the world won't do you any good if you don't take them as you're supposed to.
Remembering when to take your meds might be a problem, particularly at the beginning. It's not easy. I remember my nephew was studying pharmacy, and one of the profs gave each student a small bottle of pills to take at prescribed times. After all, that's what they would be telling patients. He and his fellow students were amazed how easy it was to forget the pills when their attention was on other things. We have a video with tips on how to remember to take pills, insulin, and weekly injectables. Take a look there. The link is below this video.
Not exercising.
Exercise is magic. I hate exercising, but I love having exercise. Moving helps us lower blood sugar quickly, and the effect stays with us long after we stop moving.
The American Diabetes Association recommends that we exercise 30 minutes on most days. For many people, that's a lot. Luckily, we don't have to do it all at once.
I often take our dogs for a 20-minute walk. That's less than recommended, but it's easy for me to find this much time. I add other movements throughout the day. And we fidget. Fidgeting is, in fact, exercise. Check out our video about it. As usual, the link is below the video.
Ignoring glucose that is too high or too low.
Ideally, we want our glucose to always stay within the healthy range. I don't know anyone that does this perfectly. It's next to impossible. However vigilant you are, there will sometimes be occasions when your glucose is out of range. A sugar low can be dangerous immediately. You can become confused or even lose consciousness. But there are signs before this happens. Different people experience lows differently. I see shimmering lights. My mom says her tongue gets numb.
I become irritable. Know the signals your body is sending you.
On the other hand, high sugar won't kill you immediately, but if it happens over and over, too much sugar in your blood does a lot of damage to your body.
So, pay attention and react immediately. If your glucose is low, eat or drink something. If it's high, move. Not drinking enough water. Water is necessary for our bodies to function well. It's easy not to drink enough. We live in Las Vegas and we often hear of various tourists requiring medical help because of dehydration. Don't let it happen to you.
But even in wetter climates, it's easy not to drink enough. Mild dehydration isn't this dramatic, but it can raise your blood sugar. We measure sugar in the blood, which is a liquid. The more concentrated the blood, the more sugar it will contain per unit of volume. Drink more water and the sugar becomes diluted.
It's not just the glucose that's a problem. Your kidneys get stressed when they don't have enough water to work with.
Other than coffee in the morning and an occasional cup of tea, we drink water almost exclusively. It has no downside. It's cheap and very good for us. We put glasses of water where we sit. We have bottles of plain water in the car. I have a bottle in my purse, so I have something wherever I go. Some cities don't have good water.
Our municipal water doesn't taste very good, so we use filters. It's a lot less expensive than buying bottled water and much better for the environment.
Drink water throughout the day.
Not sleeping enough. Who knew that getting enough sleep is a diabetes management technique? Yet it's true. Our bodies repair as we sleep glucose effectively.
We prioritize sleep. If we don't get enough at night and our schedule allows, we take naps. We have a friend that swears by naps, and she made us believers.
Not getting regular checkups. Even if you manage your glucose perfectly all the time, it's still important to get checked every now and then. This way, the doctor can catch changes that could lead to complications later.
At the minimum, we see our doctor every 3 months to check our A1C and other numbers. Your doctor should also check your feet yearly to make sure there is no neuropathy developing. In addition, check your vision yearly. Tell your eye doctor you have diabetes. They have tests that check for diabetes changes. Vision problems are often associated with diabetes, so better to be safe than sorry. The biggest problem is leaky vessels. My dad had to have regularly scheduled laser treatments or else he would go blind. Thank goodness they have this treatment. But you'll never know you need it unless you get tested.
Finally, visit your dentist twice a year. This is particularly important if you have high sugars often. Bacteria love sugar, and the bacteria in your mouth is no exception. Better to make sure nothing bad is happening there.
If you can't afford a dentist, we have an idea. Find out if there's a dental school near where you live. The students need someone to practice on, and you need treatment. The students are supervised by an instructor, so you can be sure the work is done well. It will take longer than a regular appointment, but if money is tight, this is the best solution we found.
So there you have it. 10 common mistakes that people with diabetes make. Hopefully now you won't make them.
What about you? What mistakes did you catch yourself doing? Tell us in the comments.
If you found this video helpful, give us a like. Subscribe to the Simply Diabetes channel and don't forget to tell your friends. That's the best way to help us grow the channel.
See you next week.